Hello, nice to be with you virtually over in Italy. Maurizio, I'm so sorry I couldn't be there in person. So now we're going to start one of the segments looking at neoadjuvant therapy and other therapies for early lung cancer. But before we go into our segments, I do want to fill you in on sort of the history and why we have come up with this I-ELCAP, this method of studying what we do and coming up with answers. So everybody knows I-ELCAP back in 2006 published a study in the New England Journal of Medicine that pretty much showed that lung cancer screening works. And then in 2011, the NLST trial came out, which was supposed to prove Dr. Henschke, Dr. Yankelowicz's work as being wrong, but instead it proved them right. So the methodology used proved that screening worked. Now, multiple papers that have come out of I-ELCAP, I-ELCAP have shown the difference between wedge and lobectomy not to be statistically significant. And the Al-Torki trial just showed that as well. Lymph nodes, dissection, sampling, whether or not you have to get lymph nodes, that's all been described by I-ELCAP. And then you have randomized trials that have went on to prove I-ELCAP right. So the methodology used can answer a lot of questions. We cannot keep getting stuck that a randomized controlled trial is the gold standard. For statisticians, it is. But when you're a surgeon and each patient is different and you need to look at the various variables that will influence outcome, the methodology used in I-ELCAP is the methodology that we want because it's quick, it can adapt, and it gives you very concrete answers. So welcome. Again, I'm sorry I can't be there, but I hope we have a productive meeting. And I will see you again when I talk about neoadjuvant therapy for surgery. See you in a little bit. Thanks.
Good morning, everybody. Let me thank the directors of the international conference, and in particular, my friend Maurizio for the kind invitation. In addition to my personal greeting, I bring that of the Italian Society of Thoracic Surgery. The themes of these days are all very interesting and stimulating, and the speakers are of high level, like today. Good job, everyone, and thank you for the kind invitation again.
So thank you very much. It's a pleasure for me to be here, and I think we are closing this wonderful meeting with quite a long session that actually tries to tackle the blind spot that we had in all screening trials, which is how effective, how are our ways of treating the disease that we found in a very early stage. So I think that this session will give us a glance to the future, which means increasing the cure rate by integrating systemic treatment, radiotherapy with surgery to increase the cure rate that we can get in stage 1 or early stage 2 that we find with screening. So I think this is the next very important step towards making screening more effective, treating patients more effectively. So I'm really happy that this will be the topic of the next 3 sessions, and hopefully we'll get out of here with plans for the future to make it even more effective. Thank you.